Welcome to our online course on quality evaluation of cephalometric radiography. In this module, we will explore into the essential aspects of evaluating the quality of lateral and posterior-anterior cephalometric radiographs, crucial for accurate diagnosis and treatment, planning in orthodontics and craniofacial assessment. Let's begin our journey to mastering this critical evaluation technique. The title of the third module is the Quality Evaluation of Cephalometric Radiography. In these topics, we learn about the introduction of cephalometric radiography and the use of the cephalometric radiography, and of course, the quality evaluation for lateral cephalometric radiographs and also the posterior-anterior cephalometric radiographs. And the last one, we will conclude the lateral and posterior-anterior cephalometric radiographs. Introduction. Cephalometric projections are standardized to ensure consistent imaging of the craniofacial region. These radiographs, including the lateral view, are taken using a cephalostat, which maintains a fixed relationship between the skull, the receptor, and the X-ray beam. Cephalometric radiography, including posterior-anterior views, is commonly used in orthodontics to diagnose dental and skeletal abnormalities, plan treatment, and monitor changes over time. The use of lateral cephalometry is to evaluate the relationship between the maxilla, mandible, and cranial face, and to assess skeletal and soft tissue relationship. Meanwhile, the posterior-anterior cephalometry to evaluate craniofacial asymmetry and to assess jaw-skeletal relationship. Having introduced the key concepts, now let's explore into the quality evaluation of lateral cephalometric radiographs. The first one is object coverage. Refers to ensuring that specific anatomical landmarks and structures are clearly visible and well defined on the radiographs. These landmarks include points on the skull, teeth, and other facial structures that are crucial for accurate diagnosis and treatment planning in orthodontic and maxillofacial surgery. The second one is contrast, detail, and sharpness optimal. Let's now focus on specific anatomical landmarks. We'll discuss the importance of clear visualization of the sella turcica and the lower edge of the mandible. The sella turcica is a saddle-shaped depression in the sphenoid bone of the skull where the pituitary gland is located. In radiographic terms, when it coincides or no shadow, it means that the sella turcica appears clearly and distinctly without any overlapping shadows from other structures, ensuring accurate measurement and assessment in orthodontic and craniofacial diagnostics. The lower edge of the mandible coincides refers to ensuring that the lower border of the mandible appears clearly and without superimposition or overlapping shadows on cephalometric radiograph. Moving on, we will examine the evaluation of occlusion and the positioning of the Frankfurt line. These elements are critical for accurate assessment of the craniofacial structure. Occlusion refers to the alignment and contact between the upper and lower molar teeth. Proper visualization and assessment of the molar relationship are essential for evaluating the occlusal status, which include determining whether the bite is normal or if there are malocclusions such as overbite or underbite. Whereas the Frankfurt line is an anatomical reference line that runs from the inferior margin of the orbital to the superior margin of the external auditory meatus or porion. When this line is parallel to the floor during imaging, it helps achieve a standardized and reproducible head position, leading to consistent and accurate radiographic assessments of the craniofacial structures. Next, we'll look at the significance of soft tissue shadows, particularly the nose and lips. Proper visualization of the shadows aids in comprehensive analysis. These shadows provide important information about the facial profile and soft tissue structures, which are essential for assessing the relationship between the teeth, bones, and surrounding soft tissues. Having covered lateral cephalometric radiograph in detail, let's transition to posterior-anterior cephalometric radiographs. This section will address the evaluation of craniofacial asymmetry and other craniofacial features. The first one is object cover, refers to ensuring that specific anatomical landmarks and structures are clearly visible and properly captured on the radiograph. These landmarks typically include frontal bone, the bone forming the forehead, zygomatic arch, the cheekbone, maxilla, mandible, nasal septum, orbits, and dental structures. The second one is contrast detail and sharpness should be optimal. The third one is proportional of the top and the bottom of the face, the shape and size of the teeth. The radiograph should clearly show the relative dimensions and symmetry of the upper and lower part of the face, allowing for an assessment of facial harmony and balance. Our next focus will be on assessing the visibility of the frontal sinus and nasal septum. Frontal sinus, the radiograph should provide a clear view of the frontal sinus, the air-filled space located within the frontal bone above the eyes. This visibility helps in evaluating sinus health and any potential abnormalities. Nasal septum is the structure that divides the nasal cavity into two nostrils, should be distinctly visible. Clear imaging of the nasal septum is essential for assessing its alignment and any deviations, which can affect breathing and overall facial asymmetry. Finally, we'll discuss the importance of symmetrical mandibular imaging. Clear and equal visibility on both sides is essential for accurate diagnosis and treatment planning. It means that the radiograph should show the mandible, lower jaw with equal and clear visibility on both the left and right sides. This ensures that the mandible is symmetrical and there are no distortions or asymmetries that could affect diagnosis and treatment planning. Accurate visualization of mandibular symmetry is crucial for evaluating facial balance, detecting abnormalities, and planning orthodontic or surgical intervention. To conclude, we have covered the essential aspects of quality evaluation for both lateral and posterior-anterior cephalometric radiographs. These insights are crucial for precise orthodontic and craniofacial assessments. For lateral cephalometrics, provide a detailed side view of the craniofacial structures, essential for diagnostic and planning orthodontic treatment by ensuring clear visibility of anatomical landmarks and soft tissue profiles. The lateral cephalometric radiographs must be ensured that the anatomical landmarks are clearly visible, the soft tissue profile are distinct, and the front horizontal plane is parallel to the floor. Whereas for the posterior-anterior cephalometry, offer a frontal perspective, crucial for evaluating facial symmetry, proportions, and structural integrity, including the nasal septum and frontal sinus. For posterior-anterior cephalometric radiographs, The images must clearly show symmetrical mandibular diameters, the frontal sinus, and the nasal septum to accurately assess facial symmetry and proportions. Thank you for joining us in the third module, the final module of our massive open online course on quality evaluation of radiography. We hope this course has equipped you with the essential knowledge and skills to perform accurate radiographic assessments. Your dedication to learning is commendable, and we look forward to seeing the positive impact of your expertise in the field. Goodbye, and best wishes for your continued success.